Well, it's a trial to assess the optimal medical therapy for pacemaker patients, which at the moment we have no idea about. So lots of the pacemaker patients were omitted from a lot of the medical therapy trials that have previously been conducted in heart failure. But we know that there's about 40% of the pacemaker patients that have reduced LV function. And we want to know whether we can optimally manage them and how best to treat these patients clinically. So Optimising was designed as a randomised, non-blinded, parallel study of pacemaker patients that had been implanted with a bradycardia device for longer than 2 years. There was 1,200 patients recruited over 3 centres in the north of England. And of those 1,200 patients, they were randomised 1-to-1 to receive an echocardiogram with their routine pacemaker check or just their pacemaker check alone. And what we did was look at those patients after 12 months digitally and see their clinical outcomes. So their time to event-free analysis or time to heart failure hospitalisation and mortality. Of the patients who received an echocardiogram, those that were stratified according to their recruitment centre in terms of what subsequent management they had. So patients at Leeds Centre, for example, were seen optimally in the heart failure clinic, whereas those at Harrogate and Bradford in the district centres had a letter sent to their GP, which we labelled enhanced standard care. So we could do further analysis on which types of healthcare services improve patient outcomes more. So we found that the introduction of an echocardiogram to determine patients' left ventricular function didn't have any additional benefit in terms of clinical outcomes, so time to first heart failure hospitalisation or mortality in the pacemaker population. I think more work needs to be done. We clearly know that there's a lot of these patients that have underlying asymptomatic dysfunction, and we can potentially reduce their mortality and improve their morbidity. But at the moment we can't identify which patients are at high risk, and hopefully some of our further analysis will bring those findings to light, and then perhaps we can focus our healthcare services better to treat those patients more optimally.